Is Prime Minister Carney right about healthcare?
Access to healthcare in Canada is not a business, it is a fundamental right, and we will defend it.
For many Canadian patients, this simply isn't true. They don't have access to healthcare, they have access to a waiting list. Last year, government data showed over 15,000 Canadian patients died while waiting for various surgeries and diagnostic scans. However, that data was incomplete. The true figure is likely closer to 30,000 waiting list deaths. These deaths include everything from people dying while waiting for cataract surgery, which affects quality of life, to things like heart surgery, which could have saved some lives. Of course, not everyone dies on a wait list, but many patients spend long periods suffering with chronic pain while waiting for simple operations like hip or knee surgery. It's simply inhumane. Meanwhile, Ottawa has actually reduced access to healthcare. They cut $76 million in funding to provinces that allow patients to choose between the public system or paying privately. Ottawa wants everyone to depend on government-run healthcare, even though it's not working. Prime Minister Carney is in a unique position. Until recently, he held not only a Canadian passport, but also an Irish passport and one from the United Kingdom. He could draw on his experience living in Europe to note that better performing universal healthcare systems in Europe give patients a choice: use their public system or pay privately if they wish. For example, most Swedish patients use their public system, but about 1 in 10 working-age Swedes pay for private health insurance, and that takes pressure off of the public system. Prime Minister Carney has reversed several of former Prime Minister Trudeau's decisions. It would be great for patients if he took Ottawa in a new direction when it comes to choice in healthcare. To learn more about health reform, visit healthreformnow.ca.